Greetings from Health and Beyond. I'm Dr. Shanta Misra, a health communication and wellness expert and your host for this session, Continuing Care and Continuing Education. Today we have a conversation on the continuing nurses education in India. In-service nurses are the lifeline of public health. They manage wards, comfort families, and make critical decisions every day. However, with a changing healthcare landscape, new diseases, digital tools, and complex patient needs demand more than experience. They demand updated knowledge, refined skills, and renewed confidence. That's where continuing nursing education or CNE steps in. CNE program offers in-service nurses with evidence-based updates that improve clinical judgment, specialized training in areas like geriatrics, palliative care, and infection control, leadership and communication skills to navigate multidisciplinary teams, recognition and career mobility, especially through INC-accredited credit hours. To discuss this further, we have today Mrs. K.S. Bharti, the ex-Joint Secretary of the Indian Nursing Council. Mrs. Bharti, a gold medalist in MSc Statistics from Mysore University, has worked in Indian Nursing Council for 20 years and was the overall in charge of the entire administrative and institutional related work in the organization. She is also the coordinator of the Ph.D. consortium. Some of her significant contributions include coordination for implementation of various WHO projects, close coordination and management of the large-scale Global Fund project, which was implemented for 8 years. This project was awarded a high grading of A2. Conceptualization and implementation of the nurse registration and tracking system, and many other programs to her credit. She's a very well-known person among the nursing community. Our first question would be, with your vast experience with the Nursing Council, how do you think continuing nurse education has evolved over the years?
Dr. Shanta, thank you so much for introducing me. And as the next Joint Secretary, I was working in Indian Nursing Council for quite a long time. And yes, CNE was there. CNE was there in the government nursing institutions as they were funded by the government of India. And they used to have a 10 days program because our nurses need to come out for 10 days and then only academicians used to get the profit of it. Clinicians has a problem, like, nursing superintendents and clinicians had a problem that time. But now, but we wanted to have some work. This was not mandatory. People, nurses used to go on their own and having a TADA. For them, government nursing is very nice. But the government fertility is only 25% as against the private ones. Like we have more of private institutions, around 75 to 80% in our country are from the private institutions. So they had an issues of having the CNEs. So, and we wanted to, somehow regulate to have a CNE. We had NAC, we had NIRF, where they do the rankings, where the CNE, continuous professional development is very important in any institutions. So therefore, a good leading institution like CMC Vellore, PGI Chandigarh, AIMS were all doing the nursing, but only for the limited academic. They didn't have for the all populations. Like, 75% did not have the CNEs. And then Indian Nursing Council, after a lot of deliberations, wanted to take up some CNE this thing. So what we started with is first we brought this NRTS, that Nurse Registered Tracking System, where we wanted all nurses to undergo the CNE. After the NRTS was successful, we could get around 6 lakhs nurses on board. We started to have a renewal, like every 5 years they should be renewed, and it should be connected with the continuing nursing education, like 150 CNE hours. So from that, we came out to have a guidelines which gazetted with the help of the state nursing councils, like how much we can do, why we should do. So 30 is the maximum CNERs they can do. I mean, 50 CNERs they can do, but minimum 30 to 50 they have to go. They can't do like 150 CNERs in a year only. They have to do every year so that they are updated with their protocols. And we also want this to be incentivized with the increments with the private as the government, but it will take little time. So that is what now it is increased because it is linked with the CNE renewals of license, where some state nursing councils are really doing good work. For them, it's really coming very handy, and it is all appreciated by all over the country because getting so many nurses in NRTS is very difficult, and to communicate to them, it's very, very difficult. And this also brought the clarity and structure. We said this is the one, this is the so now everybody on the board who are nurses in our country can get into the CNA with a wide range of learning formats. Like there is a shift towards competence-based learning afterwards, especially protocols for the clinicians. We wanted a competence-based learning. It's not only academicians, but also clinicians now. And the digital platforms are there. So who want to digitalize their, in the hospitals healthcare system, so they also can learn, and interdisciplinary collaborations are there now. Nurses today are not only learning about clinical updates, now they're also engaging with topics like leaderships, ethics, geriatric care, and public health. So this also includes conferences and skill labs, so like to publish research and mentoring peers. We have come out like Indian Nursing Council has come up with NRSC, National Reference Simulation Centers, where Indian Nursing Council trains two faculty of each institutions, private or government. We don't look into anybody, government or private. We say whoever wants to come, they have a portal where they can register. So these people are but we have one conditions, only two nurses from an institutions because we have around 2,000 odd BSc nursing colleges. So we want to, strengthen them. So regarding that, we have every two nursing professionals from each institutions. And we also now brought in the corporate sectors where these faculty, the corporate sector, where there are people who train in their own education, they have a cell for nurse education. So for them also we are putting them so that they can also learn from this NRSC, and we give 30 CNERs for it, and to travel is given by the Indian Nursing Council. So this is the way we are encouraging. We are also encouraging the other some hospitals, some colleges also have a simulation centers who are taking the endorsements from Indian Nursing Council. So we are also encouraging that, not only from the NRSC but also from the other colleges of nursing. So this flexibilities have empowers nurses in both the urban and remote PhD to participate meaningfully. Like, e-learnings are coming up. So you must be seeing our website, a lot of learnings are there in different languages so that they can, in their leisure time, they can do on their own.
Yes, I wanted to know, like, as you said, it's not compulsory and mandatory. So how do we make the CNE program attractive for a nurse? And also, what are the plus points? Like, what is she going to gain from this continuing education program? You've already told us that this education program is, going to teach, update your knowledge and skills and teach digital tools. But apart from that, how do we make them attracted to this program, and how will they come and join this? You also talked about flexibility in time, flexi time, which is very helpful. Anything else you would like to add?
Yeah, see, we have most of the time, like in a good way, institution, they go with the English language. We want more of the Hindi, regional languages also, because especially ANMs and GNMs who are at bedsides and communities, so they also want to have strengthened. I know, but we have made it mandatory, but it is not still coming up with the state nursing councils. I think when the NNMC comes, that becomes a mandatory. Every 5 years, they have to get the renewals. All nurses, around 30 lakh nurses, has to undergo the CNERs in one way or other. In their in-service, especially in-service nurses, they need to have it. And for attraction, as I said, it should be hybrid mode. The knowledge should always be incentivized, not only with the recognition of the continuing nursing education or they have undergone, because we give the credits, 30 CNERs or 60 CNERs, not with the credits, but also incentivize that these people will go for that particular, department. So that interesting, otherwise if they don't
Yes.
go, so if
Do
the
you think
protocol.
having good professors from reputed universities will that help? Like, because they
Of
will
course,
say
yes,
who,
of course, yes, of course, yes, because of their knowledge, their expertise, because of especially when the seniors are there and they gain the respect also from the juniors. Always
yes, of
like
course.
generally it peers or a senior you listen to, not the juniors.
Yeah,
It's in the
yeah, of
profession
course.
every in the
Yeah,
profession every.
yeah. So nurse education in India is rated highly, and the skills of Indian nurses are very much sought for by international hospitals and healthcare abroad. Do you think CNE adds value to this highly demanding and evolving health services? Do people go abroad after doing this course? What, in your opinion, is the advantage they get? Do they get jobs, better job opportunities abroad? Of course, they are in service nurses here.
Yeah, see, it is the education. See, if you're updated with your own knowledge, the latest protocols, obviously it will help in getting the better jobs outside. So we have to ensure so whatever certifications are given are also recognized by the abroad. So
Yeah,
Indian nurses are doing wonderful outside. There's
they
no
are.
doubt. So
Yeah.
we have to in par with the international way of the CNEs. We have to conduct. Then obviously they'll be recognized.
Any concluding thoughts on improving the knowledge skills of in-service nurses? You've already given us many. We at Health and Beyond are initiating a CNE on elderly care and other areas. Any suggestions on this? Elderly care, etc., which are new topics, emerging topics.
Yeah, in service, as I said, are already the backbone of India's healthcare system, and investing in the continuous learning is not just beneficial; it is also essential. As
Yes.
I said, because otherwise, as you saw in COVID, we taught so many
Yeah.
on the hybrid mode, but this becomes evolving. Every other day, we are seeing some things like we had some viral arthritis, so
Yeah.
they have to go undergo CN. That's why it's essential, especially in the healthcare department, because now with pro-COVID, too many other things are also coming. So we have to ensure that we are updated in our knowledge, and
Yes.
recognition certificate is also very, very important. So that's the right renewal and certification from a renowned institutions always takes, is better, because renowned institutions outside also taken into, like, whatever certification we give, though in the abroad also it should be recognized. It's my thing, my take is, of course, when it is from a reputed institution, it's always beneficial. And when nurses see that their learning is valued through credits,
Yes.
career pathways, or even simple acknowledgement, it promotes motivation and retention. It's not only for nurses, even for us, even. And your
Yes.
initiative to launch a CNE, I mean, I know you have been initiating an elderly care in both, which is timely and visionary. I mean, it's very important because now India is, though we said it's young for next 10 years, but still we the aging population also, many are there. So nurses must be equipped to manage multimorbidity, cognitive decline, palliative care, and respectful communication with older adults. It will be very
Yes.
beneficial to include real life cases scenarios. So that's very important, as I said, because they will learn and then from Indian caregiving context and
Mhm.
modular flexible formats like
Mhm.
online interactive sessions, exercises are usually good, because then only if it is interactive, then they learn more. Even if
Yep.
it is e-learning, but if an assignments are there, so they were serious about it. And the
Correct.
regional languages, and obviously the physiotherapists and nutritionists around with the collaboration of the other team leaders. And the things, they want creating space for reflection and peer learning. That is very, very important. So I think that will embed interdisciplinary collaborations also. So I wish you and your team the best wishes for this endeavor.
Thank you. Thank you, ma'am. So wonderful of you to say that, those kind words. Thank you, Ms. Thank you, Mrs. Bharti, for a very elaborate discussion on the importance of continuing nurse education in India. CNE is helping nurses adapt, lead, and elevate the standard of care. It is not just a policy requirement, It's a movement towards excellence in Indian nursing. Most importantly, CNE restores dignity and pride. It tells nurses you matter, your growth matters. I'm sure all our viewers, especially from the medical and nursing community, are now well informed and aware of the benefits of a CNE program. Moving forward, we at Health and Beyond are very soon launching an innovative INC-accredited online CNE course for all. Please subscribe to our channel and keep following us for further updates on this program. Thank you.
Thank you so much, Shanta. Thank you.